Hello, everyone, and thank you for your interest in this poster, where I will be presenting the results of a cross-sectional survey exploring the evolving role of the oncology nurse and nurses from the U.S. My name is Natasha Pinheiro, and I'm a solid tumor GI medical oncology nurse practitioner at Memorial Sloan Kettering Cancer Center. And I'm going to present this poster that I've co-authored with Brittany Prostacimo, Karen Waldrop, and Nina Grenon. Oncology nursing has changed significantly in recent years. Nurses in this field work across the entire cancer care continuum, from health maintenance and disease prevention to survivorship and end-of-life care. With the growing burden of cancer and advancements in clinical care, oncology nurses are taking on more specialized roles, helping to improve the quality of cancer treatment and patient outcomes. The COVID-19 pandemic also brought rapid changes to how care is delivered, and many of these adjustments have now become standard practices. The goal of this study was to explore how the role of oncology nurses in the U.S. continues to evolve. We specifically wanted to understand this evolution from the nurses' own perspectives. The study was conducted between January and June of 2024 and consisted of 3 parts: a demographic data collection where we gathered information about participants' backgrounds and roles, the survey on role evolution where nurses shared their experiences and perspectives on how their responsibilities have changed, open-ended feedback where participants provided insights into their expectations for the future, along with the challenges they face. A total of 197 nurses from 17 states completed the survey. While there was nationwide representation, most responses came from Alabama, Massachusetts, and New York. The participants were all registered nurses working in different roles, mostly in the outpatient setting. The group included nurse practitioners, nurse navigators, infusion nurses, registered nurses, and oncology nurses. More than 1/3 had over 10 years of experience, and the majority held either a master's or doctoral degree. The results from the study showed, with regards to patient education and symptom management, that most nurses agreed that educating patients on symptom management and monitoring side effects are key responsibilities in their role. They emphasized collaborating with the multidisciplinary team to provide individualized care. Interestingly, infusion nurses, registered nurses, and nurse practitioners were significantly more likely to monitor and assess side effects than nurse navigators. When asked about changes in managing treatment toxicities, the respondents described a more proactive approach with stronger focus on patient-centered care and shared decision-making, patient empowerment through education and emotional support, personalized care plans, and early intervention strategies. Another area of results focused on challenges in patient education. While most nurses take part in patient education, some registered nurses and infusion nurses reported finding it challenging. Notably, the perception of this challenge varied by experience level. More experienced nurses found it more rewarding, while those with fewer years in practice found it more difficult. The results on the multidisciplinary team involvement showed us that being part of a multidisciplinary team is essential for oncology nurses to provide effective patient support. However, 66% of the respondents reported not participating in multidisciplinary tumor boards. Nurse practitioners were significantly more likely to be involved in multidisciplinary tumor boards compared to infusion nurses and registered nurses. When it came to treatment decision-making, the responses varied. 25% of the nurses said that they collaborate on every patient's treatment plan. Another 25% indicated that they have minimal involvement, while the remaining 50% reported limited input, mainly following the oncologist's recommendations. However, oncology nurses were much more engaged in end-of-life discussions, providing emotional support, collaborating with palliative care teams, and initiating sensitive conversations about patients' wishes. Section 5 of our results talked about the impact of COVID on oncology nursing. A key focus of this study was understanding the lasting impact of the COVID-19 pandemic on oncology nursing. Most respondents reported an increased workload, particularly among registered nurses, nurse practitioners, and infusion nurses. The use of telehealth and virtual care in oncology nursing has expanded and is expected to continue growing. Section 6 of our results talked about the future of oncology nursing. The qualitative feedback provided deeper insights into nurses' perspectives on their evolving roles. Telehealth and virtual clinics were recurring themes, especially in the ambulatory setting. Nurses expect to take on a greater role in patient and family education and support. There is a growing need for enhanced communication skills, particularly in handling difficult conversations with patients and caregivers. Additionally, many respondents highlighted the need for ongoing education, both for nurses and patients, particularly in the areas of new cancer therapies, advanced technology and AI in cancer care, genetics and genomics, and the application of genomics. However, one major concern was burnout. Many nurses worry that the increasing demands of the role could lead to higher stress levels and discourage new professionals from entering the field. In summary, oncology nursing is evolving rapidly. Nurses are playing a more active role in patient education, symptom management, and multidisciplinary care. At the same time, the field is seeing challenges, including workload pressures, the need for more training, and the risk of burnout. The growing role of telehealth and advances in cancer treatment mean that oncology nurses will continue to adapt, making their expertise more crucial than ever in delivering high-quality patient care. We hope that you found this information useful. You can find more detailed slides for download on the Core2Ed website. Thank you.